When we talk about a disc, we have to understand, as Dr. Lamon said, when you have a disc, you also have two little joints in the back called facet joints. So I always think of every level of the spine as a three-legged stool. And you need all three legs intact for it to work properly. And what we do with the disc replacements is put in a new disc in the front, a metal one with plastic, or there's also one with ceramic core that we can use. But we put in this new disc, but we still rely on those two joints in the back. So those two joints in the back have to function properly or somebody won't get a good result. And so that's important to understand. So Dr. Khachatryan, when people are getting, and you're talking to them, how do you decide whether they're going to get a fusion or an artificial disc or a combination?
Before I can answer your question regarding what kind of options we offer, what makes me decide in terms of whether we should do disc replacement or fusion, I just wanted to add one more point regarding hybrids. So hybrids can be performed in a primary setting where a patient has a multi-level problem in their neck, and one level may be amenable to a fusion, and another one may be amenable to disc replacement. And Dr. Lamon described that scenario very nicely. But it is also common for me to see patients in my clinic, and I'm sure we all see in our clinics, where patients have had prior fusions performed. They come back to us with a problem next to that fusion, needing more surgery. And this, I think, is another beautiful application of motion preservation technique that artificial disc replacement offers us to perform this type of secondary hybrid surgery, disc replacement next to prior fusion. Now, again, just as Todd Lamon mentioned, it becomes somewhat challenging at times to get something like this approved with insurance companies, but it's one where I have done many peer reviews with insurance companies and tried to get them approved because I believe it's going to provide them better function in the long term to have an artificial disc replacement next to a fusion. Now, going back to answering your question that you addressed.
Before you do, can you explain to the public why it would be good for them to have an artificial disc next to a fusion?
As we talked about, there are 5 discs in your neck. So if you've had 1 or 2 level already fused, you've already lost significant portion of your motion in the cervical spine. So then now you've developed a problem next to that. So we all believe that there's this domino effect that happens with fusion. You lose motion at 1 or 2 segments. You put a lot of stress at the next level. And then if you keep fusing it, I've seen certainly in the past some patients who've had their entire neck fused, and at that point in time, the only way they can turn is by turning their lower back or their thoracic or middle back to be able to look from side to side. So preserving the functional aspect of our cervical spine, which is motion, is critical. So if we can address this additional level that now has become diseased with artificial disc, we are effectively giving that patient a new lease on life to be able to continue to function and be able to, look around their environment and do the daily activities of their life without the stiffness that comes along with fusion.
The problem with fusions are that you put increased stress in the levels above, and the FDA studies have shown that there's a much higher rate of needing surgery at an adjacent level with the fusion compared to artificial disc. It's about 1/3 to 1/4 the chance. And that's why what Armen said is a great solution for those patients that had a previous fusion, and now they come back and they wear out the next level. And one thing we didn't say earlier, just like if you had an arthritic hip today and you went in to see a surgeon and he said, well, I think you need a fusion. Well, you would turn around and walk outside, because there's no way. Everybody gets an artificial hip or artificial knee. We're getting very close to that way in the cervical spine.